Hello everyone, my name is Dr. Joel Rosen and I am really excited to talk to you today in this short little video about migraine headaches. I was at my son's soccer game this weekend and one of the moms of the boys on my son's soccer team was talking to another parent on the team and was telling her about her migraine headaches, and I couldn't help but overhear what they were talking about. My wife is a past sufferer of migraine headaches, so it found the topic interesting for me to listen as to all the different things that this poor lady had been going through, like going for CT scans, going to the neurologist, doing EMG and NCV studies, going to another doctor, being put on medication. The other lady was telling her that her son had been suffering with migraine headaches, and that potentially it could be dehydration. So there's all these things that people are attributing to migraine headaches with, and at the end of the day, it's a really big problem. Over 36 million people are estimated to suffer with migraine headaches, or 1 in 10 people are estimated to suffer with reoccurring headaches. So it's an epidemic and it really needs to be addressed. So one of the things I wanted to talk to you about was the actual cause. So I happened to interject and tell the mom that I really felt that at the end of the day, the bottom line is that there's too much inflammation in her body, and there is a neuroimmune phenomena, meaning we have all these different things like fibromyalgia, chronic fatigue, insomnia, headaches, migraine headaches, and all they are symptoms of a neurological problem and an immune problem. And ultimately what happens is our immune system gets overstressed. We produce too much inflammation in our body, ultimately causing migraine headaches. So the traditional way to help patients that suffer with migraine headaches are using triptans or anti-seizure medications. And these can be very effective. However, they're not a long-term solution. I know some patients that would like to go on these medications every day, and insurance typically will only pay for about 11 or so of the actual supplements, and their supplements or medication. There's actually 30 days or 20, 29, 28 days or 31 days in a month. So certainly the medication is not going to be paid for, nor is it something that is a long-term solution for you, for your migraine headaches, and for your liver. So it really comes down as to why. Why are you suffering with migraine headaches, or more importantly, why are you suffering with inflammation that are causing migraine headaches? The first thing that I would say is we have to be able to evaluate you for viruses. These viruses could be herpes virus, Epstein-Barr virus, varicella virus. These types of viruses, cold sores or fever blisters, they love to live around the nerve. And when the trigeminal nerve or the cranial nerve number 5 gets inflamed, that's when we get these migraine headaches. So we need to address these viruses, and typically the best way to do that is through proper testing. Next is hormones. So in this conversation over the weekend, they were talking about hormones, and the time of the month that this poor lady has these headaches always seems to be around her menstruation. And certainly there is a hormonal regulation or a hormonal dysregulation that needs to be addressed, and that's a big part of the problem. Stress. I mean, we're all under a certain amount of stress on a day-to-day basis, from the kids to our parents to finances to jobs to bosses to a whole host of physical and or mental or emotional stressors. And in today's environment, we have chemical stressors from toxins that we breathe, from the foods that we eat, from the air, from the water, from everything that we're surrounded by. Also, we have leakiness of our gut and food sensitivities and certain reactions. So if you're suffering with a migraine headache and have never been told about a food sensitivity, the biggest being dairy, soy, egg, yeast, and even sometimes nuts, these things can really trigger not an immediate reaction, but a 4 to 10 hour reaction after you take them, and causing inflammation in your body. So the best way that I suggest we do a workup for someone is we evaluate the blood work. We need to look for low-grade infections, we need to look for inflammation, for anemias, for liver dysfunction, for hormonal dysregulation. We need to also do genetic testing. It's estimated nowadays that 90% of patients that have migraine headaches have some form of methylation problems. And basically what that means is they are unable to produce the proper nutritional substrates in their body that will allow for proper detoxification, for proper inflammation control, for proper clearing of viruses, for proper neuropeptides, for 250 different processes in the body that need to happen optimally. You can't do that properly if you have a methylation problem. How do you know? You need to be tested. Also, food sensitivity testing, and basically in our office what we need to do is we need to identify the inflammatory source. If possible, we need to eliminate the inflammatory source. And lastly, we need to support your body so that your body can get healthy and reduce the incidence and occurrences of migraine headaches. So for now, till basically the end of March, I'm going to be offering a $75 workup for patients that are suffering with migraine headaches. This is where we review your blood work, we do a neurological evaluation, and we determine what different inflammatory sources are going on in your body that may be causing your migraine headaches. What I want you to do is give my office a call at 561-883-0090 and let them know you saw my migraine headache workshop video, and I will be doing a 2-visit consultation with you. Thank you so much. Again, it's 561-883-0090, and I look forward to helping you in your migraine headache. Thank you so much.